Tachycardia. Tachycardia is a heart rate that's faster than normal or more than 100 beats per minute at rest. It can start in your upper or lower chambers of your heart and can range from mild to life-threatening. Treatments include medicines, an ablation procedure, and implantable cardioverter defibrillator, ICD. Plaque, what is tachycardia? When you have tachycardia, your heart beats faster than normal for a few seconds to a few hours. Normally, your heart rate is 60 to 100 beats per minute when you're not active. When your heart beats more than 100 times a minute at rest, that's tachycardia. Because your heart beats too often, it doesn't have the time it needs to fill with blood between beats. This can be dangerous if your heart can't supply all of your cells with the blood and oxygen they need. Your heart normally responds to electrical signals from your heart's sinoatrial SA node. These signals control how often your heart beats. When you've had a scare or are very emotional or anxious or are exercising, your heart may send signals more frequently for a short time. This is called sinus tachycardia and goes away when you calm down or rest. Other types of tachycardia can come back regularly and can be more serious. Types of supraventricular tachycardia, SVT. These begin in the atria, or upper chambers of your heart, when you have an issue with electrical signals there. Atrial fibrillation, atrial flutter, paroxysmal atrial tachycardia, PAT. Your upper chamber sends out an extra electrical signal that can be too fast. Paroxysmal supraventricular tachycardia, PSVT. Types of ventricular tachycardia. These begin in your ventricles, your heart's lower chambers, when you have an electrical signal issue in that area. Ventricular tachycardia. Ventricles are beating too fast, more than 100 beats a minute. Ventricular fibrillation. A problem with your heart's electrical signals keeps it from pumping the way it should. Who does tachycardia affect? Atrial or supraventricular tachycardia can affect women and people assigned female at birth more than men and people assigned male at birth. Children, especially those who have anxiety. Anyone who's very tired or drinks a lot of alcohol or caffeine. People who smoke a lot. Ventricular tachycardia or fibrillation can affect people who've had a heart attack, cardiomyopathy, heart muscle issue, myocarditis, inflamed heart muscle, heart failure or heart disease, people who smoke or have high blood pressure or diabetes. How common is tachycardia? About 2 million Americans have atrial fibrillation, and 90,000 others per year get a supraventricular tachycardia diagnosis. Each year, an estimated 184,000 to 450,000 Americans die from ventricular arrhythmias that cause sudden cardiac death. Symptoms and causes. What are the symptoms? Some people don't have tachycardia symptoms, while others may have mild to severe symptoms. Tachycardia symptoms may include shortness of breath, chest pain, heart palpitations, dizziness, lightheadedness, fainting. Can tachycardia cause other medical issues? Yes. Without treatment, certain types of tachycardia can lead to blood clots, stroke, cardiac arrest. What causes tachycardia? Tachycardia has a number of causes, including stress, consuming more caffeine or alcohol than your healthcare provider recommends, smoking or using tobacco products, cardiomyopathy, heart attack, heart disease, or other heart problems, not enough blood in your coronary arteries, certain medicines, risk factors for tachycardia using tobacco products, diagnosis and tests. How is tachycardia diagnosed? Your healthcare provider will ask for your medical history and do a physical exam. They may also order tests. What tests will be done to diagnose tachycardia? Your healthcare provider can use several tests to diagnose tachycardia, including electrocardiogram, EKG, Holter monitor or other wearable monitor, tilt table test, stress test, electrophysiology test or EP study, echocardiogram, having a family history of tachycardia, feeling stressed, having high blood pressure, having obesity, drinking a lot of caffeine or alcohol, having a thyroid issue but not getting treatment for it, taking drugs that aren't legal, having certain heart issues, taking certain kinds of heart medicines, management and treatment. How is it treated? Treatments vary depending on the type of tachycardia. Atrial or supraventricular tachycardia treatments. Massages or maneuvers your provider does in an office visit. Sleeping more. Drinking less alcohol or caffeine. Medicine, cardioversion, ablation, paroxysmal supraventricular tachycardia, PSVT treatments, medicines, cardioversion, ablation, ventricular tachycardia or fibrillation treatments, ablation, medicine, cardioversion, implantable cardiac defibrillator, ICD. What can I drink with tachycardia? Your healthcare provider may tell you to cut down on your caffeine or alcohol intake if you have tachycardia.